we've been working together, Dr. Goldberg and I, for 10 years now in this collaborative effort to offer patients with interstitial lung disease the best care that we can. And we really feel that the multidisciplinary nature of what we do, working together and offering our individual expertise together, it really benefits the patient, not only for their care, but also for better understanding these diseases as we move forward.
And the collaboration has led to the opportunity to provide novel therapeutics to our patients, to advance research, both clinically and at the bench. And in addition to that, we've also developed patient support opportunities, such as our support group. So all of the pillars of the multidisciplinary approach to care have really been met over the last 10 years, and hopefully will be exceeded as we move forward with this collaboration.
Let's talk about the creation of the interstitial lung disease program at the Brigham and Women's Hospital. Around 2006, Dr. Hilary Goldberg is recruited to the Brigham and Women's Hospital to be the new director of the lung transplant program. Dr. Goldberg sees an opportunity to offer care of patients affected with pulmonary fibrosis, as many of these patients are actually ultimately transplanted, and decides to create a dedicated clinic for patients affected with pulmonary fibrosis. It is at the same time, I believe, that Intramune had one of their first clinical trials with pirfenidone, and Brigham and Women's Hospital becomes one of the sites for participation in this clinical trial. In parallel, Dr. Della Ripa, a rheumatologist, becomes very interested in providing specialized services for patients who have pulmonary fibrosis in the setting of autoimmune lung disease. And it's this collaboration between Dr. Goldberg and Dr. Della Ripa that ultimately leads to the creation of a formal interstitial lung disease clinic at the Brigham and Women's Hospital.
Well, hello, my name is Bruce Levy, and I'm the Chief of the Pulmonary and Critical Care Medicine Division.
My name is Paul Della Ripa. I'm a co-director of the Interstitial Lung Disease Clinic at the Brigham and Women's Hospital.
My name is Hilary Goldberg, and I am the Medical Director of the Lung Transplant Program.
So I'm George Washko. I'm a pulmonologist here at the Brigham.
My name is Lisa Hensky, and I'm the Director of the Center for LAM Research and Clinical Care here at the Brigham and Women's Hospital.
Sure. My last name is it's clearly on the tracks.
Matt Hunting-Hockey. I'm an assistant professor of medicine at the Brigham and Women's Hospital and Harvard Medical School.
My name is Suhail El-Shamali. I'm one of the faculty in the pulmonary division.
I'm Ed Kim. I'm one of the physicians and a scientist that has been supported by the IPF Fund.
Bobby Padera. I'm a pathologist at Brigham and Women's Hospital.
It's Wade. I'm a research fellow working at Dr. Al-Shamali's lab.
Carmen Priolo. I'm a medical oncologist.
I'm Tracy Doyle.
Hello, I'm postdoc fellow in Dr. Rosa's lab.
Sarah Chu, and I'm a fellow in the Division of Pulmonary and Critical Care Medicine.
I'm Anthony Lamatuna, and I work in the research lab of Dr. Suhail El-Shamali.
Hi, I'm Raju Katsuri.
My name is Philip Camp. I'm the surgical director for the fibrosis program.
Hello, my name is Caroline Owen. I'm associate professor of medicine in the pulmonary division at the Brigham.
Creating a multidisciplinary group that focuses on the diagnosis and treatment and overall management of patients affected with these rare disorders becomes a very effective way of treating patients. And so we create expertise that's focused towards improving the management of this disease. And the way that we've gone about doing it here at the Brigham is by identifying and recruiting successful physician scientists or clinicians that want to focus most of their time on studying this disease and trying to most effectively treat patients affected with this disorder.
My areas of interest include rheumatoid arthritis in the lung, scleroderma, and inflammatory myositis.
Of pathobiology of idiopathic pulmonary fibrosis. In particular, I studied the role of heparan sulfate proteoglycan, SYNTGM2,
and the role of the lymphatic vasculature in lung disease.
Therapeutic targets and novel imaging biomarkers that can be translated bench to bedside.
Has been focused on very fundamental responses of cells to injury and inflammation. And we've identified and helped to understand new molecules that promote the resolution of injury, infection, and inflammation.
My clinical and research interests are focused on LAM, which stands for lymphangioliomyomatosis. LAM is a really unusual disease that affects only women, in which the lungs are slowly destroyed by unusual tumor-like cells we call LAM cells.
Lymphatics and lymphatic abnormalities and various respiratory disorders such as idiopathic pulmonary fibrosis, COPD, cystic fibrosis, and cigarette-induced lung injuries.
I'm specifically looking at the preclinical or early stages of disease.
Clinically, I work in the intensive care unit as well as the interstitial lung disease clinic, and my research interests have focused primarily on identifying what we think are early stages of idiopathic pulmonary fibrosis.
Lipid diseases and lipid orientation studies to tackle diseases.
Therapeutic trials for the management of idiopathic pulmonary fibrosis.
Idiopathic pulmonary fibrosis, particularly the molecular mechanisms that govern susceptibility to development and progression of IPF.
The contribution of the lymphatic vasculature to lung transplant rejection.
And post-transplant outcomes, mainly focusing on transplant candidates who are sensitized.
What happens to patients post-transplant and how their biopsies change and how we can do better in predicting rejection.
Arena. We have a very large patient population here at the Brigham of women with LAM. We follow about 100 women with LAM. That's one of the largest LAM clinical programs in the United States, perhaps the largest.
Are into the pathogenesis of various acute and chronic lung diseases, including pulmonary fibrosis, COPD, asthma, and acute lung injury. Specifically, we're interested in the roles of proteinases, particularly metalloproteinases in these disease processes.
One of the important initiatives that the pulmonary fibrosis in our division of pulmonary have focused on is into acquiring important research for some of our basic science studies. And as you can see, we've acquired brand new hoods for our tissue culture systems and also incubators, which has really provided an important resource for our basic scientists to be able to develop these tissue culture systems, which is an important tool to be able to do basic research. We've also acquired an inverted microscope and other equipment that I'm not showing you in this shot, but essentially our basic scientists are directly impacted by these generous donations from the Pulmonary Fibrosis Fund.
Most of the equipment here is actually focused towards preserving human samples in a biorepository. We have multiple -80 freezers, and through a collaboration with the Pulmonary Fibrosis Fund, we've actually been able to acquire a unique piece of equipment that allows us to very effectively store samples safely for a long period of time. These are called liquid nitrogen tanks. Now these are special liquid nitrogen tanks in which the liquid nitrogen actually never interacts directly with the samples, but is contained in the periphery of this very large vial. We have multiple tanks that we've acquired through this collaboration with the Pulmonary Fibrosis Fund. And as you can see, what investigators basically do is they're able to take some of these and store samples over time.
Well, I'm a strong supporter of the interstitial lung disease team. They're a leading group, having a regional and national influence, and any way I can try to help them. I certainly look to do so.
The program has been just fantastic for both our research and for clinical care. It gives us a group of dedicated clinical providers who are very knowledgeable.
I think here at Brigham, one of the most important things we have is integrated programs, and that includes our research endeavors, so that the ILD team is integrated with the transplant team, and it really doesn't matter surgery or medicine.
The IPF fund, by supporting our work here at Harvard, has a unique opportunity to bring a bunch of different types of people, chemists, immunologists, and lung doctors into the same room.
The ILD program has been integral to my research.
The ILD program has influenced my research by providing me with clinical samples from patients with and without ILDs, including blood and lung samples that we use to investigate disease.
To be able to participate in clinical, translational, and basic science research.
A critical elements for support. This is the biorepository.
The ILD program has been tremendously helpful in my own research program.
Being a part of the Hurley registry.
We can do a lot of things in mice and in cells, but until we show that these findings that we obtain have any clinical significance, not very useful. So with the biorepository that is available in the ILD group, we're able to confirm some of our findings.
The greatest benefit to patients with pulmonary fibrosis will ultimately be a transition from simply diagnosing and characterizing them and providing treatment to developing preventative methods and working on preventing people from actually developing more advanced stages of disease.
We think this has great relevance for folks with interstitial lung disease because we think that these are natural mechanisms to promote healing and may reverse the fibrosing processes that patients suffer with in their lungs with ILD.
For women who have LAM, these types of research programs, such as this one, which is part of the ILD program, are absolutely critical. This provides hope that there will be a better future if you have LAM. And on a day-to-day basis, the research we're doing is very visible. So I hope that women with LAM all over the world will know that the research we're doing here at the Brigham is entirely dedicated to improving their lives moving forward.
I hope that blending of clinical care and molecular and basic understanding of IPF development will contribute to the improvement of patients.
Educate my patients on some of the risk factors that might impact their disease.
We have already made some changes to our clinical practice on the transplant side based on some of the research that we've done before, which has allowed us to offer transplantation to more candidates already.
Over time, these areas have been understudied, and now we're in an exciting time of trying to understand not only how these diseases behave, but whether they respond to newer and novel therapies.
One of the fundamental things a surgeon can bring to research in this area is tissue. So we have a process by which in any patient who has fibrosis, we can actually collect tissue and organs at the time of transplant and then have a fundamental ability to look at the disease process unlike any other way you could, both physically and pathologically. And so in creating a mutual tissue bank, it's allowed us to feed several different pathways of research, including stem cell research, fibrosis research, and we are now doing research using ex vivo perfusion.
We're trying to find strategies that would allow us to take off-the-shelf medications that we think will modulate the lymphatic vasculature.
I'm working with the group to identify biomarkers to understand disease. If we can understand disease, that will allow us to develop new treatments, have better clinical trials, and I think quicker translation of science to the bedside.
Utilizing a reagent that promotes lymphatic regeneration, we're able to alleviate the rejection response in the lung.
This is an exciting time for the clinic and an exciting time to be studying interstitial lung disease in patients with rheumatic disease, and I'm glad to be a part of that.
Okay, so this is a fun question. Don't think too hard about it. If you were left on an island and you were only allowed to bring one thing with you, what would you bring?
One item on an island.
Seriously, ask this question?
Yes.
I wouldn't mind having my piano with me.
I would like to have a book. I'm a huge fan of novels, non-fictions, and I'm a big fan of an American Greek writer called Joseph Heller, and I would love to have one of his books titled Catch-22 with me.
Thing? Yeah, like one singular thing. Thing, not person, just thing.
One thing with me. Oh boy.
People magazine.
People magazine.
Okay. I read People cover to cover, and that's my outlet. So I need to know what's happening in pop culture.
Cool.
Having read this question before, and the prudent thing to say is that we take my family, but if it had to be an item, it would either be my iPod with all my music, or probably the funk music, my funk music.
My body.
Your
Are there power outlets on the island? Okay. I'd probably bring an N64.
Oh, really?
Yeah, old school.
The book? You have a book in mind, a specific book? It's not the PubMed printout, is it?
No, it's a collection of essays.
My phone. Your phone. My phone. Right.
Right?
Gonna say that?
Yes.
I'm sure a million people say their phone and their laptop, but I think you have a cast iron pan. Cast irons, but you can do a lot with it. So.
Soccer ball. A knife?
Apologies of my microphone. Right, excellent.
Probably two answers. The first is my family, but the second would be some kind of GPS looking black box that can be rescued from the island.
My running shoes. Your running shoes.
If I were on an island with no other belongings, I would bring
A boat?
Okay. Practical to get you off the island and back to where you want to be. Great. Thank you so much.
So, what is your answer?
Standing here in front of the Interstitial Lung Disease Clinic at the Brigham and Women's Hospital. I want to thank everybody for watching this video. I want to thank our producer and co-producer, Sergio Poli and Elaine Fletcher, for all this hard work and putting this together. But most importantly, I want to thank all of you, patients and family members and friends who are associated with the Pulmonary Fibrosis Fund, for your support over the last years. We feel very strongly that we have made great advances in the management and treatment of this disease, and expect over the next years to have more successes. And look forward to working in collaboration with all the donors of the Pulmonary Fibrosis Fund. Thank you very much.